The CEO of Google said that he believes that artificial intelligence is on the level of the invention of fire. 80% of the stories are scaring you to death. Yes, this is a technology that used wrong will definitely be dangerous. It's going to change everything we have known about life. What I like to do when I see an innovation or even something, like COVID, and then how we dealt with COVID, why is this happening? Why? Why now? Because every innovation, every event, but particularly every innovation, comes from somewhere, has an effect, and takes us somewhere. And it's an interesting way to stop and think. So what might artificial intelligence mean to the human race? So a few things jump out at me. What if Gene Roddenberry, Star Trek, got it right? That, you remember the charge to the Star Trek people was go forth and explore, don't interfere with the evolution of all those races you see, but if you can kind of help a little bit, that's okay, but you can't interfere with their evolution. Artificial intelligence could maybe help take us there, because the challenges of travel into space and so forth, right now at least exceed human capability, because remember, they had warp speed. We don't have that, right? So we haven't invented anything like that yet. But what if those explorers are androids? What if they are human values, the human history, but they can travel forever and theoretically live forever, and charged with the right mission, maybe could do that kind of good? That's a wild idea, but it's possible. It's conceivable. I mean, we're now, if you watch their articles right now, there is definitely a way to capture and digitize you and I, capture our entire history, our value system and everything, and to put that inside of a mechanical robot that could theoretically live forever. So we wouldn't have to wait another 20,000 years till we invent warp speed, or 10,000 years. We could do it, soon. So it's that's one wild one. Let's do something much more pragmatic. We have a crisis in healthcare, a serious crisis right now, and and this is pragmatic optimism in the long run, but it's going to be a difficult period here, where we have been losing clinicians for a number of years, the numbers of clinicians, and faster than we can replace them. And at the same time, we have an aging population that requires more and more care. And there's all kind of science going to help us, not just AI. There's going to be new pharmaceuticals. There's going to be new scientific innovations that help us detect disease earlier and all those kinds of things. But for the next few years, this is a right now problem, which probably many of you people have already experienced, which is suddenly you can't get in to see a specialist. It'll take you months in most cases. And you're very likely going to see a nurse practitioner who is a gatekeeper for the specialist. So that's a problem. And so particularly if you've got something you can't get diagnosed and you're bouncing around the healthcare system, they send you to a gastroenterologist, they send you to a heart person, and you can't figure out what's going on, but it feels like you're having a heart attack or it feels like you're having a stroke. Real common problem right now. It's going to get worse. The only way that I can see today that we get out of this fast is by taking the work that clinicians do today. Every clinician has 10, 20, 30% of what they do that does not require them. They're doing administrative, they're doing paperwork, they're doing keeping in touch with the patient's family that can require a lot of time if you're a nurse or a doctor, which is understandable. Patients want to know how, but we have to have a better way than we do now, than them taking that time. So that's one of the ways that AI could very quickly, we could see the impact. We may have to become accustomed to having a preliminary diagnosis, like where you would go to your primary care doc, done with AI assistance. It'll probably be better, because it can ask a lot of the same questions. It can go through the questions, the preliminary questions the doctor or the nurse asks us, and then pass you to the doctor. So all of those things save time. And so one of the ways we work out of the healthcare crisis we're in is through AI. So that's a positive. And we're in a race. We are truly in a race of declining clinicians. And you can't suddenly decide tomorrow, gee, I need another, 500,000 cardiologists. It doesn't work that way. It takes a long time to train people. So this is a real live right now problem. And how I think, though, some of the solutions that I just talked about with productivity can be put in place very fast with AI. One of the bigger concepts that is in my book that I find is one of the hardest things for people to understand, even when I do speaking, is that this idea that because life is more complicated now and we're all busy, even children are very busy, none of us look up and see what's coming. Perfect example, we should have seen COVID come. We should have been much more prepared as a country for a pandemic. We'd had minor pandemics before. We were not very well prepared. There's really no excuse. Today, suddenly there's shortages not just of healthcare workers, there's shortages everywhere. We've known since 2005, the decline in birth rates has been going on for 50 years. 25 years ago, I think it was 2005, a guy I knew wrote a seminal book. He was with one of the think tanks, and he also had a TV show in the Boston area. His name was Ben Rottenberg, and he wrote this book called Fewer. That said, population's declining, and it's building, and that's going to ultimately create a whole series of challenges. It's not the end of the world, but we're going to have to adapt and adapt fast. No one paid attention. No one. I spoke on it. I've been speaking on it off and on for years, and people just don't pay attention. Same thing with AI. AI is 40 years old. 40 years old. Nobody's paying attention to it. It's one of those, I'll worry about it tomorrow. So learning, that's one of the things we're going to have to adapt to in the future, is being a lot more aware of where things are going. And what do we do to be prepared? That's what that book, the 7 things I wrote in the book are the first 7 things to get prepared, but that's not all of it. And so this is strictly a result of people paying attention. We've grown up for, centuries now, thinking the institutions will take care of this. I don't have to worry about it. They're not. The institutions are behind. They're not keeping up. So all the med schools didn't graduate enough people. They were actually, they made the requirements even tougher. And so they were actually constraining supply. To me, it's almost like life saying, it's time to grow up. The 21st century is when individuals assume their rightful place. Life's up to them, not the institutions. They can't keep up because we can change faster than they can. The 21st century should be the age of the elevation of human potential. AI done right, we talked about, here's something healthcare can be a huge thing. Someday it can promote, enable a kind of space travel we couldn't possibly do as human beings for centuries, if not millennia. But it can also elevate what we do. So one of the principles in my book is that as automation, AI being part of automation, but other kinds of automation as well, as it will assume the work that is repetitious, dangerous, and requires a lot of physical exertion. And everybody goes, they look at it immediately negatively. Well, what are all those people going to do? Well, I happen to believe in human beings more than that. I believe all those people doing repetitious work, that's not good human work. We're creative sorts. We're good at human relationships. We're good at complex problems that are very difficult to try to figure out the answer, but we're creative and we'll go at it. That's better work for human beings. So give that 20, 30 years, human beings could be doing a whole different level of work, much more satisfying. Repetitious, I don't know anybody that loves repetitious work. We all have repetitious work around the house we don't particularly like doing. So those things could all be automated with AI. That's a good outcome of it. And jobs are a function of, I mean, we define work today as 40 hours a week. What if it was 30? And we used our time in other ways. That's not necessarily a bad thing either. We're coming out of the industrial age, and so all of us think, go to work, go to the factory, whether it's a white-collar factory or it's a blue-collar factory, or, we go there, we commute to get there. It's a lot of the work we don't really enjoy. Some of it we do. It's very top-down. You got generals at the top, and, that's all industrial age stuff. What if it was completely different? What if when and where we worked was much more dynamic? That I was an independent contractor and I worked for 10 different companies, but in different roles when I was needed. Much more like special forces. Think about special forces, military's way ahead of us. They're moving away from big armies in the field and top down to special forces, and that's what they rely on these days. Maybe it's going to look a lot more like that. And you can take the same thing into education. Education and workplace are following parallel paths, with workplace proceeding at a faster pace, as you would expect, in its dynamism to education. They both ask in the same question. Yes, people need to be together at times, but does it have to be 5 days a week, 8 hours a day? Can it be something more dynamic? One of the other things that artificial intelligence, among other technologies, allows us to do is to personalize it. So not everybody needs this same structure. Not everybody thrives in an industrial age structure. So let's tailor it to where we maximize everyone's productivity and therefore their joy in work and joy in life and joy in learning. In history, we've never had that opportunity. We've never had that opportunity to construct work, life, education around me. That's the meaning of democratization. And these technologies are empowering democratization. That's the huge change going on here. It's going to change everything we have known about life. Human beings are being challenged as never before. Think of some of the decisions your children are going to have to face. How do they make a decision when everything they read, everything they hear, everything they see could be fake? How are you going to do that? How are you going to answer the question, I believe that the human race is being evolved for abundance or extinction? You don't know, so it doesn't tell you about what will be, it tells you about yourself. If you watch, and I do every day, the media, 80% of the stories are scaring you to death. 80%. You didn't hear them talking about the need for health care. You didn't talk about them saying this could empower possibly exploration of the universe in ways we've never known, would never been possible before, and a million other uses. Being able to do science at a level we've never done it. But I'm also pragmatic. Yes, this is a technology that used wrong will definitely be dangerous. The CEO of Google said that he believes that artificial intelligence is on the level of the invention of fire. Now think about that. Wow, if he's right or if he's half right. But I imagine when fire was invented, that 9 out of 10 people said, this is wonderful. We can cook our food. We can stay warm. We can be safe from animals now. And 10% of the people said, we can use this to burn down our enemies' huts. That's life. So if we think we're going to invent great things and somebody's going to try to figure out how to do bad things with it. That's just not the way the world works. And we have to say, okay, that's coming, so what are we going to do about it? I wasn't thrilled with the way that big tech just dumped this out on the public. When we invent new pharmaceuticals, they're required to go through a rigorous testing process to understand what the harm it could do, how to use it. We didn't do that. It was just boom. And we haven't learned to do that yet with technology. And think about how different it would have been if they would have just spent 1 year, 2 years with controlled trials, and an academic review of those controlled trials. How different we'd feel about it today. It was an irresponsible way to do it. And so we have to be smarter about that in the future.